Are you into working out and sports since your weight loss surgery? Wondering what to eat before and after your workouts? If you need more carbs, maybe calories too? Do you need a supplement for muscle gain? Coming up, bariatric sports dietitian Kim Terapeli joins me to answer many of your questions and share the latest on sports nutrition.
They're back. Calcium Dark Chocolate Bars, a ProCare Health customer favorite. Now available online at procarenow.com. Creamy chocolate plus calcium and vitamin D. You'll love them too. Use code SUSAN10 to save 10%.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 137. Tired of all the hype and confusion when it comes to nutrition, especially bariatric nutrition? It's enough to make you say, forget about it. I don't know what to do. Well, I do. I know what to do. When it comes to your bariatric surgery, nutrition is specific. So let's cut through all the hype. Let's get to the accurate nutrition information you need to know. Simple strategies that work in your real life. I created the Bariatric Surgery Success podcast for you. You're in the right place, and I'm glad you're listening. I want to give a shout out today to Lovey, who said, "You're the best, Dr. Susan. Your topics are always informative and relatable." Well, thank you, Lovey. That's my goal, to provide you with helpful information that meets you where you are right now. Well, joining me in the studio is dietitian Kim Terapeli. Kim and I have had a hard time this morning getting me to pronounce her name correctly.
That's okay.
She's a certified specialist in sports dietetics who focuses on bariatric sports nutrition. She's worked with bariatric clients and athletes for the last 16 years, since she was also a collegiate sports dietitian for a Division I university. Now, Kim works one-on-one with her clients to optimize nutrition to meet exercise goals after weight loss surgery. And you can also listen to Kim on her podcast, the Active Bariatric Nutrition Podcast. Find all the links to Kim's website, her podcast, or social media, all in the show notes. Well, hi, Kim. I'm surprised you want to join me after I butchered your name now about 3 or 4 times. I'm so glad you're here today.
Oh my gosh, no problem at all. I'm so honored to be here. Thank you for having me.
Well, when I first found out that you were going to be a guest on the podcast, I put a poll in my Facebook group to see what questions they had about sports nutrition, and they had a lot. So let's jump right in and answer as many as we can today.
Sure.
So first up, I want you to clarify, because I think this is something so many people wonder about. How far out from surgery should you be before you start heavier workouts like lifting and different types of sports?
Yeah, that's a great question. So, always obviously the surgeon, your surgical center will give guidelines as to when you can begin, weight training or lifting after the surgery. But, as you know, and as our bariatric patients know, is in the first year, your intake is somewhat low, and exercising demands higher nutritional intake. So typically what I see where folks can start to really kind of increase it slowly, definitely through the first 3 months. But even if you want to start lifting more, heavy weights, I would say at least a minimum of 6 months before you're really trying to, significantly increase, weight training. And then again, like I said, you have to kind of listen to your body based on how you feel and how you're able to fuel for that movement.
And do you think the same thing, Kim, for sports? So if someone wants to get into running again, or training for, let's say, half marathons, or starting to bike heavy, do you still say 6 months, or do you like that to go out to a year, or does it depend on the person and their surgery?
It does. It's going to be highly dependent on, what surgery they had, where they're at with their fueling, how much they can tolerate, how much they can take in. Because of course, more endurance training does require, more carbohydrate intake, more overall energy intake. And so it's typically harder to do in those earlier first 6 months to do more endurance training. And so typically what I see is folks start off, with the lower levels. Maybe they're going to start a couch to 5K, and then they can build up from there. But you're going to be fueled better for that type of activity if you're a little bit farther out from when you had your surgery. 6 months is typically where folks have, gotten through those initial stages. They're starting to increase different variety of food intake. They're adding more carbohydrate to their protein. And so they can feel a little bit better in doing that type of activity.
Agreed. And now some of these questions coming up are going to be pretty broad and generic, and some of them are a little bit more specific to some of the people in the group. But one of the questions really broad: do I need more calories every day if I work out hard? And I know hard is a word that's varies person to person. So how do you address that?
Yeah. So yes. So I definitely take a look at what they're doing. How often they're working out, how long is the workout, and other factors that come into play too, again, is where you are with your nutritional intake from when you had your surgery. Are you able to tolerate more calories? And yes. So in general, to answer the question, typically it does require some increase in calories to fuel the workouts. But again, it depends on the type of exercise that you're doing. And so what I usually will say is, see how you're feeling, take a look at your overall intake. How do you feel in your workouts? Gauge from there whether, I'm just feeling really run down. I don't feel like I'm recovering well. That's where maybe we need to look at, are you taking inadequate protein to help with muscle recovery? Do we need to bolster in a snack pre or post workout that has maybe a little bit more carbohydrates so that, again, you can get through that workout better fueled?
And I'm thinking too, because we have a number of people who are trying to gain muscle. And the generic question there was, well, how many calories should I add if I'm trying to gain muscle?
Yeah,
do you look at that just the same way as a hard workout or a little differently?
Yeah. So specifically for muscle gaining, we're going to look at number one, overall calories. I generally start low. So when I work with someone, I will see where they're at, what's their baseline calorie intake. And then if they're like, yes, I am really trying to build muscle, I typically will recommend starting with a very conservative increase of about 200 calories. Because for someone that hasn't had bariatric surgery, they may increase, somewhat higher, maybe 500 calorie jump.
Right.
And that's not going to be doable for a bariatric client, just because they can't tolerate that much volume. So I typically start with maybe 200 calories. We see how we feel. We gradually increase. And then the second part to that is going to be, yes, we focus on your protein as well. Overall, total daily protein intake is the number one factor for muscle gaining. We need to look at how many grams are you taking in now? Where can we kind of increase that to see that muscle gaining, goal be achieved?
Yeah. So that was the next question. Do I need more grams of protein daily for my workouts?
Yes. So typically what the recommended range is for muscle gaining, and keep this in mind, this is utilizing your goal weight, or even if you know your lean body mass, the recommended range is about 0.7 to 1 gram per pound. And so what you would do is you take your weight, again, you would use your goal weight that maybe your surgeon is recommending you work towards, or if you know your lean body mass through a body composition measurement, you can multiply that by 0.7 at the low end, which is where I always recommend we start. We don't need to jump up high. Start there and see, okay, what is that amount of grams of protein, and see if I can reach that. And then you can gauge if you need more than that based on your trend.
Okay. And then going along with carbs and that, the next question was, how many grams of carbs do I need daily for my weight training? And this kind of goes with another, so I'm going to put it in with it so you can think of them together. Should I eat more carbs if I'm exercising more? So I guess we're looking at both exercising more and weight training, and how does this affect our grams of carbs?
Yeah, so that's a great question. So as you know, carbs kind of get a bad rap, so to speak.
Yes, they do.
Right? And it's like, they're good for us. It's okay.
I know it.
So I typically say, listen, when we get to a point where, hey, you're doing a great job on meeting your protein intake, because of course that's the priority initially after the surgery. And then we start kind of liberalizing the diet. We start introducing, more vegetables and fruits and whole grains. Those are great for you. And they help fuel our muscles for exercise. So because carbohydrate is the main energy source, especially at higher intensity workouts. And if you are trying to gain muscle, we do need those carbohydrates as well. Typically, I look at where they're at with their intake, how they're feeling, and then I will say, okay, usually bariatric clients can tolerate, anywhere from maybe about 30 grams at a meal. Maybe they can start increasing that incrementally by 15 grams. Because again, with a bariatric athlete, you can't just say, let's use these sports nutrition guidelines, which recommend significantly higher amount of carbs.
Right. Yeah.
Not
Absolutely
applicable.
not.
Yeah, not applicable to a bariatric client. So you have to start where they are. And I typically will just do increments of 15 to 30 grams at a meal to see how they feel. And then I'll also strategize with them as timing of maybe adding in a snack if they need to pre-workout, especially if they're, exercising a long time after they've had their last meal. Maybe it would benefit them to throw in something like a Greek yogurt, which has carbs and protein and well tolerated. And that way they're seeing those carbs come in that can fuel their muscles. So to answer your question, there is no set number of carbohydrates that I could say to every person out there, this is how many you need, because it's so individualized. But what
Agreed.
I would and what I would say is just let's find out where you are right now. Let's maybe add 15 grams at each meal, see how you feel. And that can be something like a half banana. That's 15 grams. That can be like, a piece of toast if you want. Maybe you add some peanut butter to that. And we go from there.
So, side note, we already know that people have a fear of eating carbs, right? And they're like, oh no, I don't want to eat the carbs. I'm going to gain weight. And you know that they need more carbs for their workout. How do you overcome that feeling of, I don't want to add carbs when you know they need carbs?
It's something, and when I work with, the client one-on-one, it's something that we talk about, because think of it more as a mindset shift of we're fueling our body to achieve these goals that you have of, moving your body. You're trying to, maybe achieve some, we start a half marathon or you're cycling, and such great, exciting goals, or weightlifting. And the carbohydrates are just an energy source. They're just fuel for our body to be able to move more efficiently and effectively and feel better in the workout. So I typically start with, let's talk a little bit about the mindset around carbohydrates, and then finding what works for them and what they enjoy. And we start with that. It's about adding and optimizing the plate. It's not about like good, bad. I try to stay away from that. All foods can fit. And we just have to find what works best for you and what you tolerate.
Well, we'll be back in a moment, and Kim will tell us whether it's normal to be hungrier some days than others. Don't go anywhere.
Bariatric Surgery Success is thrilled to partner with New Hope Girls, women empowering women. They offer a discount to our community. Code TRANSFORM to save 15% and celebrate our shared commitment to transformation. Shop their beautiful bags at newhopegirls.com.
Okay, Kim. So is it normal to be hungrier some days and not others?
Absolutely. And that just changes regardless of exercise or not. But certainly when you are increasing exercise over time, you often will have maybe increased appetite, and that's totally normal. And what I say to that is, again, we're looking at how do you feel in the workout? How are you recovering? How are you sleeping? And that's where we look at maybe it is time to bump up, an additional 100 calories or adding in that pre or that post-workout snack that has some carbs and protein to help us feel more full. And the other thing I usually tell folks that are feeling a little bit more hungry is let's look at your overall timing. Are you going long periods without eating? Are you skipping meals? Are you in a pattern where you're just kind of snacking throughout the day rather than sitting down and using that full capacity of your new small stomach to, put in protein, carbohydrates, feel more full, and be able to go 3 to 4 hours without kind of that, feeling that hunger again. So again, it's strategizing with timing of intake, what we're eating at the meals, making sure we're getting in protein, fiber, and just being consistent with that.
Yeah, consistency. I think that's so important, right? Okay, so these questions are getting a little bit more specific. So Kim asked, I work out 5 to 6 times per week, cardio and strength training. I just can't seem to lose this last 20 to 25 pounds. Could it not be enough water, liquids? I'm stumped.
That's such a great question. Yeah. I mean, certainly dehydration and, something that I tell folks is, we always focus on our calories and, what we're doing for exercise and that kind of thing. And why am I not losing weight? So definitely if you're dehydrated coming into workouts, you won't get the most out of the workout because you're going to fatigue sooner. So fluids do play an indirect role, and we don't really give it credit for it. The fluids do play a role, but more so I would say, let's take a look at other factors too. How are you sleeping? What's your stress level in your life? Are there other things going on that could be hampering, your trend? And then I would just look at, have you changed your exercise routine lately? Has it been the same routine? You've been doing the same type of cardio, the same type of lifting. Sometimes just mixing things up will get us out of a plateau. And then lastly, nutritionally, I would take a look at logging intake and seeing what am I actually getting in a typical day, week? What are my trends telling me in terms of my calories and my overall energy intake? Is there something there that we can change a little bit. Because sometimes we live life and, we get off track a little bit. We don't realize that, I've had this or that, and things can add up. Maybe we don't realize it. So just kind of tuning back in and being a little bit more mindful oftentimes can really help as well.
And I think that's so true, Kim. I know that people will say, oh, do I have to log again? Do I have to log? But sometimes when you are what you feel like stuck in a rut, it just really helps to go back and do that, even if it's just 3, 4, 5 days, because you'll go, oh, there's a pattern. I didn't realize I was doing that all the time now. Yes. Or look what I added there. And it is really eye-opening if you'll be very authentic and open with yourself and put it down and write, what you're really doing.
Yeah,
Don't you think?
I couldn't agree with you more on that. And again, it's meant to just be data. And I always just tell folks, and I don't tell people they have to log every day for life. It's just meant to be, hey, what's going on? Can I get a snapshot of my current patterns and understanding this is just data to help me understand if there's something that I need to change.
And I think it's a place for both of us to say, we don't judge what you put in the journal. Because I have had numerous clients say to me, listen, you're going to think I have a horrible diet, or don't judge me. And I'm like, this is a no judgment zone here. What I'm looking at as trends so that I can help you in your journey forward. I'm not looking at to go, really? I can't believe she ate that yesterday. You know?
Yes, totally. I agree with you 100%.
And I think that's so important to know. It's not about judgment at all. It's just about helping you be the best you can be. Yep. Okay. Karen wants to know, I had RNY September 2022. I'm a regular CrossFitter and vegetarian, always looking for more knowledge. So what's the latest and greatest in that world, Kim, that you might offer?
Yeah. I mean, I right away when I have clients that are vegan or vegetarian, I just, remind them, listen, we need to make sure we are getting in our protein needs, because it can be more challenging with a vegetarian or vegan diet just because
yes,
higher,
for sure.
Higher fiber intake from fruits and vegetables and, the whole grains. So number one, just making sure you're getting in your protein each day, especially if you're doing the CrossFit, which is a lot of, resistance training and explosive movements. And generally speaking, a vegetarian diet does provide ample carbohydrate because, again, it has a lot of that plant-based proteins and carbs. And they're all great. That's excellent. So I would just say the other thing to take a look at is making sure you're being very consistent with your bariatric vitamin and minerals, because as a vegetarian or vegan, whether you're a bariatric athlete or a regular, non-bariatric client, vitamins and minerals of interest for vegetarians and vegans where they have to really make sure they're getting this in would be iron, vitamin B12, calcium, vitamin D. And those are ones that are important for bariatric patients as well. So having that vegetarian vegan diet, being, very active and bariatric patient on top of it, those vitamins and minerals are really important to make sure that you're staying on top of lab checks, making sure you're taking your vitamins and minerals so that those levels are staying normal.
Because you can really drag if your iron level's low and
Totally.
And your workouts just aren't going to be where you want them to be.
100%. Yes.
Okay. And Jason asked, I'd like to get back into running after bariatric surgery. Any tips to safely get back into running, and nutrition tips too?
Yeah, no, great. I just like anyone that's starting a new routine, it's always a good idea. Check in, physical therapists are great resources, personal trainers, making sure that you're at a place where you can start that activity. And I've had lots of guests on my podcast that are, physical therapists that always just say, start slow. We don't need to jump into a half marathon training program right out of the gate. Start with walking. And once that's consistent, maybe you add in some jogging and just start slowly, and that way you can build up and reduce the chances of injury or illness occurring from being run down. So I would start with that. And then in terms of the nutrition side of that, I would see how you feel in your walks or runs. And do I need to have maybe some carbohydrate, 15 grams in the hour or two before my workout so that I have that fuel to get me through my walks or my runs? And I would start with that and see how you feel and stay hydrated too.
I think that's great advice. Okay. A little more broad question. What should I eat before or after a workout?
Well, great question. So what I typically, let me just start with this. Everybody's different in how much or what they can tolerate, as you know. And
yes, very individualized.
Totally. And so some athletes that work out super early in the morning, they're like, listen, I can't have anything. And so this is what I'll recommend. So for someone that's, working out, especially early in the morning, make sure that you are incorporating carbohydrates at your meals throughout the day. Make sure that the night before, especially if you know you're going to have a harder workout in the morning, incorporate those carbohydrates at your meal, whether that's your vegetables, your whole grain with your protein. But if it's later in the day, for example, you're incorporating those carbs at your meals, and the hour or two prior to your workout, if you can try to incorporate 15 to 30 grams of carbohydrate. And again, just to give you an example, a half banana is 15 grams, a whole banana is 30 grams. So it's not something, a huge amount, or even a Greek yogurt, which is going to give us 15 to 20 grams of carbohydrate. It doesn't have to be a lot. You can start slow. I've had a lot of bariatric clients be successful with the applesauce pouch, just squeezing that in as they walk out the door and getting that into their system. And that would be pre-workout. And then post-workout, again, as long as you're eating on a consistent schedule, what they've shown to be most important for recovery, again, is just overall calories and protein goals being met in the day. Then timing of meals is the next most important in the hierarchy of, nutritional strategies. So if you are looking to optimize that, you want to, again, if you can try to get in about 15 to 30 grams at least of carbs in that recovery meal, paired with about 20 to 30, maybe upwards of 40 grams of protein, depending upon what you can tolerate, that's really going to help refuel those muscles to get you ready for your next workout.
And as we wrap up, I have one last question that came up several times. Are supplements helpful for muscle gain? And if so, which ones?
Yeah, that's a great question. So number one, nutrition, first strategy is always look at what you're overall eating. Okay. There is no supplement in the world. There is no silver bullet, right? That can fix or help you.
Unfortunately, no.
I wish there were, but, so number one, we need to look at what are you eating? Once we optimize we're looking at maybe strategizing with maybe an increase in calories. Let's see where we are. Optimizing your protein intake, carbohydrates, timing, things like that. After we look at all of those things and make sure we're doing great on those, then if we can look at some supplements. So obviously one supplement that has been very, very well researched, the number one most researched supplement out there is creatine monohydrate. Before I even talk about it, I always tell every single patient, you never start a new supplement without discussing that with your doctor first. Okay. But creatine monohydrate has been very well researched in that it does help with increasing power and strength and in your workouts. And that's because creatine provides basically an energy source to our muscles, a phosphate group that helps create ATP, which is the energy currency in our cell that allows us to do those explosive movements. If you supplement with creatine, it can help you be able to work out longer, harder. And so creatine has been one supplement that has been shown to be beneficial across multiple populations. And in fact, I just had a guest on my podcast that talked all about creatine. And then I would just say, looking at, again, rounding out, making sure your bariatric vitamin and minerals that you're taking every day, that those levels are normal. And those would be kind of the ones I would really hone in on first.
Great answer. Thank you, Kim. I really appreciate your time and your willingness. You have answered so many questions that came through the Facebook group, and I know they're going to be excited to hear this podcast, and all of your good information. Such good information. You've got to come back again.
I would be honored to, and I'd love to have you on mine as well.
Thank you so much. Well, bottom line, you heard Kim. Everyone is different. And nutrition is always individualized. So get with your bariatric dietitian. If you're into sports, get with Kim. Remember, it's about making sure what you do works for you, your transformation, and your journey. You are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC, all rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.